When you recognize that a patron in the water needs help, you must respond immediately. In most cases, you will enter the water to perform a rescue and then approach the victim. Throughout your training, you will practice entries and approaches together. This helps you to make the smooth transitions needed for fast and efficient rescues. The objective of the entry is to get into the water quickly and safely with any necessary rescue equipment and begin approaching the victim. When deciding which entry to use, consider the depth of the water, the type and position of the lifeguard station, the presence of obstacles in the water, such as patrons or lane lines, the location and condition of the victim, the type of rescue equipment you are using, and the design of the facility. A slide-in entry is the slowest but safest way to enter the water. You can use a slide-in entry when the pool is too crowded to enter safely by jumping, or when the victim has a suspected head, neck, or spinal injury and is close to the side of the pool or a pier. To perform a slide-in entry, sit on the edge of the deck or pier with your feet in the water and your rescue tube beside you. Lower yourself into the water. Place the rescue tube across your chest and under your armpits. Focus on the victim and begin your approach. A stride jump allows you to enter the water quickly from the deck or a low height while keeping the victim in your line of sight. Only use a stride jump when the water is at least 5 feet deep and you are no more than 3 feet above the water. To perform a stride jump, stand on the edge of the deck with the rescue tube across your chest and under your armpits. Hold the excess line so it doesn't get caught on anything. Lean slightly forward with your chest in front of your hips and focus on the victim as you leap into the water with one leg forward and the other back. Squeeze your legs together right after they enter the water to provide upward thrust and limit submersion. Focus on the victim and begin your approach. A compact jump allows you to enter the water quickly. You can use a compact jump from the deck or from a low height to enter shallow water. When performing a compact jump from a height of 3 feet or more, make sure the water is at least 5 feet deep. Remember that entering the water from an elevated stand may not be safe if your zone is crowded or if the stand's position or design makes a jump risky. If a jump is unsafe, climb down from the stand and enter from ground level instead. To perform a compact jump, stand on the edge of the deck, lifeguard stand, or pier with the rescue tube across your chest and under your armpits. Hold the excess line so it doesn't get caught on anything. Jump out and away, keeping your knees bent and your feet together and flat. Maintain this position after you enter the water to absorb the shock if you hit the bottom. Allow the rescue tube to bring you back to the surface. Focus on the victim and begin your approach. Use a run and swim entry to enter the water from a zero depth area or from a shoreline. To perform a run and swim entry, hold the rescue tube and excess line and run into the water, lifting your knees high to avoid falling. When you can no longer run, make sure the rescue tube is across your chest and under your armpits and start swimming. Alternatively, drop the rescue tube into the water and start swimming, allowing the tube to trail behind. When using the run and swim entry, never dive or plunge head first into the water, because this could cause a serious head, neck, or spinal injury. The objective of the approach is to safely, quickly, and effectively move toward the victim in the water while keeping them in your line of sight and maintaining control of your rescue equipment. You can swim toward the victim with your rescue tube under your armpits and torso. Use a modified brushstroke or front crawl. As you swim, keep your head up and the victim in sight. If the rescue tube slips out from under you, or if you need to swim a long distance, let the tube trail behind. Without taking your eyes off the victim, reposition the tube in front of you just before reaching the victim. When the victim is in shallow water, it may be most efficient to walk to them. Walk as quickly as you can. Position the tube in front of you before contacting the victim. In extremely shallow water, you can quickly walk or run to the victim. If you are using a rescue tube, position it in front of you before contacting the victim. When a victim is submerged, your objective is to quickly and effectively contact the victim and bring them to the surface, supporting them on the rescue tube and maintaining an open airway while you quickly move to the exit point. If the victim is below the surface and beyond your reach, you will need to use a feet-first surface dive or a head-first surface dive to access the victim. To do a feet-first surface dive, position your body vertically in the water. Press both hands down at your sides and kick strongly to raise your body out of the water. Take a breath and allow your body to descend. When you are completely underwater, sweep your arms overhead to propel yourself down. Repeat this sweeping motion until you reach the desired depth. As you descend, keep your legs straight and together, with your toes pointed. Tuck your chin and look toward the bottom, and exhale gently. To descend to a moderate depth, you may only need to sweep your arms once. To do a head-first surface dive, build your momentum with a swimming stroke. Take a breath. Sweep your arms backward to your thighs. Tuck your chin and flex sharply at the hips while reaching your arms forward and downward toward the bottom. Lift your legs upward, keeping them straight and together, so that your body is in a fully extended, streamlined, and nearly vertical position. The weight of your legs will drive you downward. To go deeper, do a simultaneous pull with both arms. Look toward the bottom and exhale gently. When descending to a moderate depth, keep your body streamlined, but descend at an angle instead of straight down. Gently exhale and look in the direction you are going. If the water is murky or the depth is unknown, keep at least one arm extended over your head. To rescue a victim submerged in deep water, swim to a point near the victim and perform a feet-first surface dive, keeping the rescue tube strap around your shoulder. Alternatively, do a head-first surface dive and change to a feet-first position before contacting the victim. Position yourself directly behind the victim, with your chest to their back. Reach one arm under the victim's arm and across the victim's chest, holding firmly onto the victim's opposite side. Reach up with your free hand and grasp the toe line. If your feet are on the bottom, push off to gain momentum. Pull the toe line down and feed it into the hand that is holding the victim. Keep pulling the toe line this way to ascend with the victim. As you approach the surface, position the rescue tube below the victim's shoulder. At the surface, ensure that the victim is supported on the rescue tube with their mouth and nose out of the water. If the victim is slipping off the rescue tube, position the tube lower, under the victim's back. Then, reach one arm over the victim's shoulder, grasp the rescue tube, and use your other arm to stroke to the exit point. In very deep water, you may need to remove the rescue tube strap from your shoulder and hold it in your hand to gain enough length to descend to the victim's depth. If the combined length of the tow line and strap is not enough to allow you to reach the victim, release the strap, grasp the victim, push off the bottom, and kick to the surface. Once at the surface, position the rescue tube to support the victim. If the rescue tube is out of reach on the surface of the water, another lifeguard can retrieve it and place it in position so that you can continue with the rescue. If necessary, move the victim to an exit point without the rescue tube. In shallow water, approach a passive submerged victim by quickly walking or swimming to their side. Facing the same direction as the victim, reach down and grab the victim under their armpits, submerging if necessary. Pick the victim up while moving forward, turning the victim onto their back so that their face is out of the water. Position the rescue tube to support the victim. and maintain an open airway while you move to a safe exit point. In moderate depths, do a surface dive and position yourself at the victim's side. Grasp the victim's arms midway between the elbows and shoulders and move them alongside the victim's head. Push the victim's arm that is closest to you down and away while pulling the victim's other arm towards you to turn the victim face up while bringing them to the surface at an angle. At the surface of the water, position the rescue tube to support the victim, and then move the victim to the exit point while maintaining an open airway. After moving the victim to a safe exit point, the objective is to safely and effectively remove the victim from the water and to provide appropriate care. To decide how to remove the victim from the water, consider the features of your intended exit point, the victim's condition and size, and the availability of other team members to assist. When extricating a victim from the water, your own safety is important. To lower your risk for injury, use good body mechanics when pulling, pushing, and lifting. Work with another rescuer whenever possible. And use good communication to coordinate your movements. This will give you twice the power and make the move easier. When a victim appears unresponsive or is unable to bear weight, a backboard with the head immobilizer device removed can be used to extricate the victim from the water. Using a backboard at the pool edge is an easy and fast way to extricate a passive victim. As the rescuing lifeguard swims with the victim toward the side of the pool, an assisting rescuer on the deck places the backboard vertically in the water against the wall, submerging the headspace if possible. The rescuing lifeguard raises one of the victim's arms so that the assisting rescuer can grasp it, and slides the rescue tube out from under the victim. The assisting rescuer holds the handhold with one hand and the victim's wrist with the other, while the rescuing lifeguard stabilizes the backboard. When the victim is centered on the backboard, the assisting rescuer pushes down on the head end, while the rescuing lifeguard pushes up on the foot end to bring the backboard to a near horizontal position. The assisting rescuer signals that they are ready to remove the victim.
On the count of 3, 1, 2, 3.
And pulls the backboard onto the deck while the rescuing lifeguard pushes. Pull the backboard at an angle, keeping it low to the ground. Do not try to pull the backboard up and out of the water vertically. A second assisting rescuer can help hold the backboard and pull it onto the deck. Alternatively, the rescuing lifeguard can exit the water and help pull the backboard onto the deck. The second rescuer on the deck grasps the victim's wrist in addition to the handhold, if needed to help stabilize the victim or the backboard. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care. You can extricate a victim on a backboard using the steps. Before removing a victim on a backboard using the steps, consider your own and the assisting rescuer's size and strength, the number of steps, the size and weight of the victim, and the availability of additional rescuers to assist with holding, pulling, and lifting the backboard. If you do not think you can safely exit the water with the backboard using the steps, consider using another extrication method instead. The rescuing lifeguard moves the victim to the steps, while the assisting rescuer places the backboard in the water at an angle against the steps. The assisting rescuer holds the handhold with one hand and grabs the victim's wrist with the other as the rescuing lifeguard stabilizes the backboard from the side. When the victim is centered on the backboard, the assisting rescuer signals that they are ready to remove the victim. The assisting rescuer pulls the backboard at an angle up the stairs and onto the deck while the rescuing lifeguard pushes. If more than one assisting rescuer is available, they should grasp the handhold and the victim's other wrist and help pull the backboard up the steps. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care. When there are steep steps, moving water, or both, use this technique. The rescuing lifeguard supports the victim in a face-up position with their arms extended alongside their head and walks toward the exit point. The assisting lifeguard enters the water with the backboard and guides it into position under the victim. Each lifeguard grasps one of the victim's wrists and one of the handholds on the backboard. The lifeguards carefully and gently drag the backboard up the steps, taking one step at a time. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care. At a pool or waterfront, the exit point may be a zero-depth entry. The rescuing lifeguard supports the victim in a face-up position with the victim's arms extended alongside the victim's head until the assisting rescuer arrives with the backboard. The assisting lifeguard guides the backboard into position under the victim. Each lifeguard grasps one of the victim's wrists and one of the handholds on the backboard. The lifeguards lift the head end of the backboard and drag it out of the water. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care. You may be able to lift a small, passive victim out of the water. Rotate the victim into the crook of your arm, supporting their head above the surface of the water. Place your other arm under the victim's knees. Carefully lift the victim onto the deck or walk out of a zero-depth area. Then, assess the victim and provide appropriate care. At a shoreline or zero-depth entry, the beach drag may be used when a victim is unable to walk. Once you reach shallow water, stand behind the victim and move your rescue tube out of the way. Firmly grasp the victim under the armpits, supporting the victim's head as much as possible with your forearms. Walk backward, dragging the victim to dry land. Use your legs, not your back. Then, assess the victim and provide appropriate care. A beach drag can also be performed with 2 rescuers. Each lifeguard should grasp the victim under an armpit and support the victim's head. If the victim can walk, use a walking assist. Place one of the victim's arms around your neck and across your shoulder. Grasp the wrist of the arm that is across your shoulder and wrap your free arm around the victim's back or waist. Maintain a firm grasp while you help the victim walk to safety. When you are clear of the water, have the victim sit or lie down. Assess the victim and provide appropriate care.
In an aquatic setting, head, neck, and spinal injuries can occur in the water or on land. These injuries are serious because they may involve the brain, spinal cord, or both, and can lead to permanent disability and death. Head, neck, and spinal injuries are often caused by high-risk or high-impact activities, such as entering shallow water head first, falling or entering the water from greater than a standing height, striking a submerged or floating object, colliding with another swimmer or the wall, or striking the water with high impact, such as when water skiing or surfing. In pools, head, neck, and spinal injuries most commonly occur at the shallow end, in a corner, or where the bottom slopes from shallow to deep water. When a person is injured in the water, you should only suspect a head, neck, or spinal injury if you witnessed an activity that was high impact or high risk, and signs or symptoms of a head, neck, or spinal injury are present. Brain injuries can result from a blow to the head, a penetrating injury to the head, or exposure to forces that cause the head to snap forward and then back. Brain injuries include bruising of the brain tissue, bleeding into the space between the brain and the skull, and concussions. A concussion is a traumatic brain injury that alters the way the brain functions. Concussions can occur anytime a person experiences a bump, blow, or jolt that results in rapid movement of the brain within the skull. Signs and symptoms of concussions and other brain injuries include the mechanism of injury, which means the method by which the injury occurred. A change in mental status, for example, confusion, disorientation, memory loss, or loss of consciousness. Dizziness. Vision changes, such as blurred vision or double vision. Nausea or vomiting. Seizures. Loss of balance or stumbling. And the inability to do activities that the person could previously do. It is not always easy to tell if someone has a concussion or other brain injury. Although a person may show signs and symptoms immediately or very soon after a blow to the head, in some cases it may be hours or even days before signs and symptoms are seen. If the mechanism of injury makes you think that a concussion or other brain injury is a possibility, it's best to treat the person as if they have a brain injury, even if they aren't showing signs or symptoms. Advise them to stop their activity immediately and make sure 911 has been called. Also, keep in mind that any impact significant enough to cause a brain injury could also cause a spinal injury. Spinal cord injuries can result from direct injury to the spinal cord itself or from damage to the bones that surround the spinal cord. Depending on the severity of the injury, the person may lose movement, sensation, or both in body parts below the level of injury. In aquatic settings, severe spinal cord injuries resulting in paralysis are rare. When they do occur, they usually occur in the neck region or cervical spine. Signs and symptoms that might cause you to suspect a spinal cord injury include the mechanism of injury, head, neck, or back pain, or a visible injury, a partial or complete loss of sensation or movement in part of the body, and the inability to do activities that the person could previously do, such as walking. If you witnessed a high-impact, high-risk activity and suspect a head, neck, or spinal injury and the person is in the water, immediately activate the EAP. Then, if necessary, enter the water using a method that minimizes water movement. The person may be standing in the water or holding onto the wall. They may be holding their head or neck. If the person is able to stand and walk, assist them out of the water to a position of safety while they continue to self-splint. Approach the person from the front so that they can see you without turning their head. Instruct the person to avoid nodding or shaking their head when answering questions. Provide verbal guidance to help the person exit the water, or, if necessary, enter the water to assist them. Walk closely with the person toward the exit. You can offer to hold their arm or put an arm around their waist to keep them steady. Guide and steady the person as they exit the water. If the person cannot stand or walk, perform a rescue while providing inline stabilization of the person's head, neck, and spine, and then move the person to shallow water if possible and practical. Quickly form an initial impression, and then remove the person from the water. If the person appears to be unresponsive and not breathing, or has another life-threatening condition such as life-threatening bleeding, you must immediately remove them from the water using a rapid extrication procedure and provide resuscitative care. Don't take time to strap the person onto the backboard or use a head immobilization device. Otherwise, if the person is breathing, extricate the person using spinal motion restriction. You'll learn more about inline stabilization and spinal motion restriction extrication techniques later in this course. Once the person is on land, continue with the rapid assessment and provide care for any life-threatening conditions. When the person's condition allows, perform a secondary assessment and care for any conditions that you find according to your level of training. If you suspect a head, neck, or spinal injury and the person is on land, immediately activate the EAP and instruct someone to call 911 and get equipment. Approach the person from the front. Instruct the person not to move and to avoid nodding or shaking their head when answering questions. If the person is lying on the ground, have them remain in the position in which they were found, unless you need to move them to maintain an open airway, give CPR, control bleeding, or provide care for another life-threatening condition. If the person is standing and their condition becomes unstable, putting them at risk for falling, have them sit in a chair. Or if a chair is not available, slowly lower them to the ground with the assistance of other lifeguards. Limit excessive movement of the head, neck, or spine while the person is being lowered. While you wait for EMS to arrive, have the person rest without moving, help maintain their body temperature, and provide care for other injuries that may be present, according to your level of training. If for any reason EMS was not called, advise the person to follow up with a healthcare provider as soon as possible for a full evaluation.
When a victim is thought to have a head, neck, or spinal injury and cannot stand or walk, you will use specialized rescue and extrication techniques to minimize movement of the head, neck, and spine while moving the victim to the exit point and removing them from the water. Remember, you should only suspect a head, neck, or spinal injury if you witnessed an activity that was high impact or high risk, and signs or symptoms of a head, neck, or spinal injury are present. Caring for life-threatening conditions, such as respiratory arrest, cardiac arrest, or life-threatening bleeding, takes priority over minimizing movement of the head, neck, or spine. So, to determine how you will proceed with removing a victim with a suspected head, neck, or spinal injury from the water, form an initial impression. If the victim does not appear to be breathing, remove them from the water as quickly as possible. Do not delay care by using spinal motion restriction techniques. If no life-threatening conditions are present, minimizing movement of the head, neck, and spine is a priority. Move the victim to the exit point, taking care to maintain inline stabilization. Avoid moving the victim any more than is necessary. When possible and practical, move the victim to shallow water for extrication using spinal motion restriction. Continue to monitor the victim's condition. If at any point the victim stops breathing, immediately remove them from the water and begin resuscitative care. The head split technique uses the victim's arms to help hold the head in line with the body. Vary the technique slightly, depending on the victim's position in the water. To perform a head splint when the victim is face up at or near the surface, approach the victim from the side, grasp the victim's arms between the shoulder and elbow, and gently move them alongside the victim's head. Firmly squeeze the victim's arms against their head to help keep the head in line with the body. If the victim appears to be unresponsive, quickly look for breathing. If the victim is breathing, maintain the head splint as you move the victim to the exit point. In deep water, use the rescue tube under both of your arms for support. When the victim is face down at or near the surface, approach the victim from the side. In deep water, use the rescue tube under both of your arms for support. Grasp the victim's arms between the shoulder and elbow and move them alongside the victim's head. While squeezing the victim's arms against their head, slowly glide the victim forward, turning them face up by pushing the arm that is closest to you down and away, while pulling the other arm toward you across the surface. If the victim appears to be unresponsive, quickly look for breathing. If the victim is breathing, switch to an overarm head splint in preparation for extrication. Apply firm pressure with your arm that is underneath the victim to pull them toward your chest. Reach over the victim with your other arm and grab the victim's outside arm between the shoulder and elbow. Move your arm that is under the victim to between the victim's shoulder and elbow on the victim's inside arm. Firmly squeeze both of the victim's arms against their head and begin to move to the exit point. When the victim is submerged, you witness the incident, and you suspect a spinal injury based on the mechanism of injury, such as a high-velocity collision with another person or a hard surface, you will need to bring the victim to the surface while minimizing movement of the head, neck, and spine. Approach the victim from the side, releasing the rescue tube if the victim is more than an arm's length below the surface. Grasp the victim's arms between the shoulder and elbow and move them alongside the victim's head, squeezing firmly. As you bring the victim to the surface at an angle, rotate them to a face-up position by gently pushing the victim's arm that is closest to you down and away while pulling the other arm toward you. At the surface, another lifeguard can place the rescue tube under your armpits for support. If the victim appears to be unresponsive, quickly look for breathing. If the victim is breathing, switch to an overarm head splint and move to the exit point. When possible and practical, move to shallow water to extricate the victim. To perform a head splint in extremely shallow water when the victim is face up, position yourself above the victim's head. Grasp the victim's arms between the shoulder and elbow and gently move them alongside the victim's head. Firmly squeeze the victim's arms against their head to help keep their head in line with their body. If the victim appears to be unresponsive, quickly look for breathing. If the victim is breathing, maintain them in this position and continue to monitor their condition while you wait for help. If the victim is face down in extremely shallow water, approach the victim from the side. Grasp the victim's arms between the shoulder and elbow and gently move them alongside the victim's head, squeezing firmly to secure the victim's head between their arms. Roll the victim toward yourself, stepping from the victim's side to above their head and lowering your arms so that the victim's arms move over yours. Remember to maintain inline stabilization throughout the turn. If the victim appears to be unresponsive, quickly look for breathing. If the victim is breathing, maintain them in this position and continue to monitor their condition while you wait for help. The head and chin support technique is another way of providing inline stabilization. Use this method when the head splint technique cannot be used. For example, for a victim who has one arm, the head and chin support technique can be used when a victim is face up or face down near the surface of the water. When the victim is face down, the water must be at least 3 feet deep in order to use this technique safely. To provide inline stabilization using the head and chin support technique, approach the victim from the side. Place one forearm along the length of the victim's breastbone and the other forearm along the victim's spine. Gently hold the victim's jaw with one hand in the back of the victim's head, near the base of the skull with your other hand. Squeeze your forearms together, clamping the victim's torso between them. Be careful not to place pressure on the front or back of the victim's neck. If the victim is face down, you must turn them face up. Submerge and roll under the victim, turning the victim over. If the victim appears to be unresponsive, quickly look for breathing. If the victim is breathing, maintain the head and chin support as you move them to the exit point. Spinal motion restriction techniques are used to minimize the risk for additional injuries during extrication and transport when a victim has a suspected head, neck, or spinal injury and is unable to stand or walk. At least 2 lifeguards are needed for extrication using spinal motion restriction. Throughout the entire process, inline stabilization must be maintained. When extricating a victim using spinal motion restriction, communicate with other rescuers to coordinate your movements. This is safer for you and for the victim. You should also communicate with the victim. Let them know what you are doing and provide reassurance. Remind them to answer your questions verbally instead of nodding or shaking their head. Remember, your priority is to care for any life-threatening conditions. If at any time the victim is not breathing immediately remove them from the water and provide appropriate care. In preparation for extrication using spinal motion restriction, the rescuing lifeguard provides inline stabilization using an overarm head splint and moves to the exit point. Whenever possible and practical, the exit point should be in shallow water. An assisting rescuer on the deck places the backboard at an angle in the water against the wall, submerging the headspace if possible. The rescuing lifeguard guides the victim onto the board, placing the victim's head onto the designated headspace. The assisting rescuer stabilizes the board by pressing down on it with both elbows and takes over inline stabilization by grasping the victim's arms between the shoulders and elbows. The rescuing lifeguard secures a strap high across the victim's chest and then stabilizes the victim by placing one hand and arm on the victim's chin and chest and one hand and arm under the backboard. The assisting rescuer places the victim's arms across their chest and then places the head immobilizer device and secures the victim's head to the backboard using a forehead strap. When the victim is secured, the rescuing lifeguard moves to the foot of the backboard while the assisting rescuer holds the head of the backboard. The assisting rescuer signals and then lifts the head of the backboard onto the pool deck. The assisting rescuer signals again, and the lifeguards pull and push the backboard onto the deck. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care. Some pools have high edges or a large gap between the surface of the water and the pool deck. When this is the case, the assisting rescuer should enter the water to assist with placing and securing the victim on the backboard. The rescuing lifeguard provides inline stabilization using an overarm head splint, while the assisting rescuer enters the water and guides the backboard into position under the victim, centering the victim's head on the designated headspace. The rescuing lifeguard maintains inline stabilization, while both lifeguards move the victim and backboard to the side of the pool. The assisting rescuer places a rescue tube under the head of the backboard for support, and then takes over inline stabilization. The rescuing lifeguard secures a strap high across the victim's chest, and then stabilizes the victim by placing one hand and arm on the victim's chin and chest, and one hand and arm under the backboard. The assisting rescuer places the victim's arms across their chest, and then places the head immobilizer device and secures the victim's head to the backboard using a forehead strap. The assisting rescuer holds the head end of the backboard while the rescuing lifeguard exits the water, and then passes the head end of the backboard to the rescuing lifeguard and moves to the foot of the board. The rescuing lifeguard signals and lifts the head of the backboard onto the pool deck.
1, 2, 3.
The rescuing lifeguard signals again,
1, 2, 3.
and the lifeguards pull and push the backboard onto the deck. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care. When a victim with a head, neck, or spinal injury must be extricated from the narrow space of a speed slide, at least 3 lifeguards are needed for extrication using spinal motion restriction. The first lifeguard provides inline stabilization. The second lifeguard assists with turning the victim onto their side so that the backboard can be placed underneath the victim, while the third lifeguard brings the backboard. To keep the victim's head, neck, and spine in alignment during the move, the second lifeguard places their hands on the victim's far hip and thigh, while the first lifeguard maintains inline stabilization. Working in unison, the first and second lifeguards roll the victim onto their side. The third lifeguard centers the backboard under the victim, and then the first and second lifeguards carefully roll the victim back onto the backboard. Alternatively, multiple lifeguards can lift the victim up and slide the backboard into place underneath the victim. After securing the chest strap, the second lifeguard takes over inline stabilization by placing one hand and arm on the victim's chin and chest. The first lifeguard places the victim's arms across their chest, and then places the head immobilizer device and secures the victim's head to the backboard using a forehead strap. When the victim is secured to the backboard, the lifeguards lift the backboard and the victim out of the slide. Once the victim is safely on the deck, the lifeguards assess the victim and provide appropriate care.